Greetings, Your Excellencies, ladies and gentlemen. My name is Dr. Soumya Swaminathan. I'm the Chief Scientist at the World Health Organization, and it gives me great pleasure to address you for a few minutes this morning on the very important topic of strengthening health response and preparedness that you are discussing today. Of course, the world has really been through a lot, and what the pandemic has done has set us back even further from achieving the SDG targets of 2030. And if we look at different aspects of health, whether it's delivery of health services, whether it's more investments in the health workforce, whether it's on the upstream determinants of health, all of these have been impacted because countries have focused all of their efforts and finances on dealing with the pandemic. We also have to recognize that we live in a world where threats are increasing day by day, whether these are threats to health through climate change, threats to food and nutrition security because of ongoing wars and conflicts, and of course the ever-present threat of a new pandemic, a new virus that originates in animals and jumps into humans, a so-called zoonotic disease, for which the chances are increasing day by day because of deforestation, because of urbanization, because of the illegal trade in wildlife. All of these factors make it much more easy for humans and animals to be in close proximity, and therefore the chances of viruses also jumping from humans either through domestic animals or directly from wild animals to humans, and then there's always a chance that one of these viruses then becomes highly pathogenic and causes a disease. It's happened with HIV, it's happened with Ebola, it's happened with the Nipah virus, it happened with SARS-1, MERS, and now SARS-CoV-2. And of course, there's the ever-present threat of a pandemic influenza virus arising from mutations and recombinations. And so we really need to think very seriously about the investments that are going to be needed in health systems. At the global level, we're talking about the architecture, the global health architecture, and what needs to happen in terms of the governance, in terms of the financing, and in terms of the tools and systems that we need for global solidarity. One thing we did see was that the scientific community really rose to the occasion and was able to develop and deliver diagnostics and vaccines and therapeutics at record speed. There was a huge amount of global collaboration. This was also facilitated and coordinated by the WHO, which laid out a research roadmap for SARS-CoV-2 right in February of 2020. But where we did not see the solidarity was really in equitable access to these health products. So whether it's diagnostics, whether it's drugs or vaccines, we see a huge difference between high-income and low-income countries in terms of their access, in terms of the time that it took for some of these products to become available in the low-income countries. And this is despite all of the efforts that were made through the ACT Accelerator, through mechanisms like COVAX. So clearly going forward, I think we need to think about the investments really into three interdependent priority areas. The first being health promotion, which is preventing disease by addressing its root causes, addressing air pollution, addressing the challenges in dietary diversity, in people not really being able to get a nutritious and a balanced diet, addressing road safety. We lose a lot of lives every year because of road safety, addressing the mental health crisis, water, sanitation, housing. All of these are very important determinants of health, and in fact they have much greater impact on the lifespan, the life expectancy, than the actual healthcare that's delivered in a hospital or a health center. And we haven't paid enough attention to health promotion and well-being. So that really should be where the multi-sectoral actions, the all of government approach needs to be taken, and every sector needs to be thinking about how can they make policies which impact health, and at least not make policies which are going to lead to worse health outcomes. The second area, of course, is primary health care. We need a renewed focus on primary health care. We saw during the pandemic that those countries that had built a good primary healthcare system with good community engagement and empowerment, actually did the best in terms of outcomes. So we need to really support a radical reorientation of health systems towards primary health care as the foundation for universal health coverage. And thirdly, of course, health security. That's something everybody is talking about. It is absolutely interlinked, because you cannot set up a system. The health system is just one. So what we need is strong national health systems that are interlinked, connected, accountable to the communities that they serve, and which advance gender equity and human rights. And at the national level, really a substantial proportion of the capacities that are required for health emergency preparedness and response are indivisible from those required for health promotion and the reorientation of systems towards universal health coverage based on primary health care. So targeting these common capacities for investment will accelerate progress towards the health-related sustainable development goals, at the same time as boosting national and global health security. And as I said, there are areas where there is the boundaries of the health system and other governmental and societal sectors will intersect. These are education, finance, animal health, and agriculture, and the environment, to name a few. We did see that the pandemic has had a huge impact, a huge toll on education, for example, of children, and this is likely to be felt in the future. And in fact, it's estimated that there may be trillions of dollars loss of GDP to those countries where a lot of children could not go to school for 2 years during the pandemic. So in some countries, school closures lasted much longer than in other countries. Of course, all of these efforts really need to first happen at the national level, which means increased domestic investment in health along those three interdependent areas, and then thinking about how to build regional systems and support plans. For example, in R&D, it is really important that the concept of regional health security be thought through. For example, we found that in some regions of the world which had very limited manufacturing capacity, they were the ones actually who were waiting for a long time for products because they couldn't produce their own. The Asia Pacific region has enough manufacturing capacity, but still there are health products for which there isn't enough. So identifying those areas, developing regional networks both for R&D, for clinical trials, as well as for manufacturing using some of the new technology platforms we have now, the WHO mRNA Technology Transfer Hub. There are a network of 15 hubs and spokes around the world, and in the future, hopefully, all of these can use that capacity in mRNA technology to develop other health products, not just COVID vaccines, but products that we need for the treatment of TB and malaria and cancer, for example. So I think this is a very important time for these discussions to happen, and I'm confident that the discussions during this panel will enable us to chart a path forward where countries focus on their own domestic health systems, but then also look to developing and strengthening regional mechanisms and then global mechanisms, because once there's an infectious disease threat which can turn from an epidemic into a pandemic, then you need all of these three levels to be working seamlessly together in order to defeat the enemy, which in this case is a virus. Thank you so much for giving me this opportunity. Thank you.